grab your heaviest Theraband and your ball. We're going to come once again to lie supine, putting the ball under the tailbone and wrapping the Theraband around the arch of one of our feet. Guide the tailbone down so that we really get lumbar extension. Dorsiflex the foot. We're working on the plantar flexion of the ankles, combating it. At the same time, we're getting a great calf and hamstring opener. Keep one arm down for stability purposes. Do your best to connect with your breath here. Each exhale is a chance to go deeper into the stretch, to bring the leg a little closer to you without bending the knee. You can have a micro bend if you have bow-legged hyperextension in those legs, if you have a bit of bow-leggedness. Otherwise, I'd encourage you to keep the legs straight and the foot dorsiflexed. Check in with your breath. Inhale through the nose, as if you're putting on a tight pair of pants. Suck the abdominal wall in, hold it in, lift up on the muscles that stop your stream of pee. Fog a mirror with your exhale. Inhale through the nose, pull the navel in, lift up on the muscles that stop your stream of pee. Pull the leg closer, fog a mirror. Go ahead and switch sides, setting up on the other side. Footwork is essential before doing standing work because we want to use all sides of the feet evenly. This will help balance the flexibility, and it will help with the recruitment of the right muscles for strength training. So again, using the exhale to go deeper into the stretch. Watch out for the rib cage spraying out. Back ribs press heavy into the floor, tailbone reaches away. Inhale through your nose, pull the abs in, brace them as if you're putting on a tight pair of pants and holding them in. Brace, brace, brace. Exhale. Don't let that belly push out when you're exhaling. Inhale through your nose, pull the abs in towards the spine. Lift up on those muscles that stop your stream of pee, and exhale the air out the mouth, holding that lift. Pulling the leg closer on that exhale. Let's come out of that stretch, making our way up to stand. We're going to bring our roller by the wall and grab a 3-pound weight and our ball. The ball goes between the inner thighs. I'd like you to start working your non-dominant arm. So your non-dominant arm should be to the outside of the wall, the farthest away from the wall. Make your way up onto the roller, soft bend in the knees. You should be holding onto a wall or a countertop for safety purposes. From here, once you have your balance, I'd like you to hinge forward from your hips. Arm is relaxed down, and we'll begin some back flies from this hinged position. Lifting up, 2, 3, and lowering down, 2, 3. Taking it up, 2, 3, and lowering, 2, 3. So a good thing to think about here is the tailbone reaching away from you, so you have some lumbar extension, the belly button staying pulled in and up towards the spine. Soft micro bend in the elbow of the arm that's going out to the side, keeping the shoulder plugged down the back. Lifting up, 2, 3, inhale, lower, 2, 3. One more time. And lower with control. And slowly step off the roller. We'll set up on the other side. Take your time here. Make sure when you step up onto that roller, your knees are bent. Make sure you have a wall. Safety first. Hinge forward from the top of the hips. Soft bend in the knees. We're not in a squat. And begin your arm work, taking it up, 2, 3, and down, 2, 3. Exhale to lift, bracing the abs, tailbone reaching away and back. Inhale, lower. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. 2 more. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. We're going to come off of the roller carefully. We will grab our heaviest loop. We'll grab our heaviest Theraband and our lightest loop band, bringing the loop band around the ankles and the heaviest Theraband behind the back. Pull out on that band. This will help you find the serratus anterior, shoulder blade anchor. Set up profile to the wall. You're going to step to the side towards the wall in the frontal plane to balance in knee flexion. Pulling out on the band, hold it here. Inhale 1, dorsiflex the foot, exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and bring it back. Repeating again on this side. Stepping to balance, soft bend in the supporting knee. Equal weight between the bone of the big toe and baby toe. Sternum reaching back towards the back ribs, tailbone reaching back away from you. Abs pulling in and up. Pull out on that band. Palms should be facing forward. And let's make our way to the other side, setting up. When you're ready, step to balance, keeping a soft bend in the supporting knee. Inhale 1, breathe. Exhale 1. Inhale 2, exhale 2. Inhale 3, exhale 3, and repeating. Step to balance, soft bend in your supporting knee. Dorsiflex that lifted foot. You're in knee flexion. You're pulling out on the Theraband behind you with the palms forward. Your focus is eye level or slightly higher. Collarbones wide, shoulders plugged down the back. Rib cage is closed. You can think about that sternum reaching towards the back ribs. And from here, we're going to come against the wall. We'll take the bands and set them to the side for an eagle serratus anterior release. Eagling up the arms, crossing one elbow under the other. Tailbone is against the wall. Feet are slightly in front of the wall. You're just going to round forward. The upper body relaxes, and the elbows reach away from the chest and towards the chest. Away from the chest and towards the chest. And away and towards, round up, switch those arms, rounding back down, move the arms away and towards, and away and towards, one more time, away and towards, rounding up. Turn and face the wall, step your dominant leg back, look over your shoulder, make sure it's nice and parallel for a calf stretch for the gastrocnemius, very overactive muscle with flat back posture. Drive the hips forward. Keep your focus now up, eye level in front of you. Pull the abdominal wall in. Each exhale is a chance to go deeper, driving the heel down behind you. Keep driving the pelvis forward at the same time towards the wall. Keep the abdominals firm. And let's focus on your transverse abdominis here. Inhale through the nose. Pull the abdomen in. Lift up on the muscles that stop your stream of pee. Hold that lift as you exhale the air out. Drive that heel down into the floor. Inhale through the nose. Abs in. Brace the abs. Pelvis presses forward. Heel drives down as you lift up on those pelvic floor muscles that stop your stream of pee, and you're fogging a mirror with your exhale. Go ahead and step forward. Legs should start hip distance apart. Step the opposite leg back. Look over your shoulder. Make it perfectly parallel, that foot. And then square the hips to the wall, driving them forward towards the wall. Hands should be about chest height. Focus up, eye level. Shoulders down the back. Inhale through the nose. Pull the navel in. Brace the abs. Exhale, drive the heel down and the pelvis forward. Inhale through the nose. Abs in. Brace. Drive the heel and pelvis forward, heel down. And one more time, inhale through the nose. Like you're putting on a tight pair of jeans, suck the abdominal wall in, hold it in. Lift up on those muscles that stop your stream of pee. Sustain that lift as you fog a mirror with your breath. Stepping forward. Great job. grab your anti-burst ball. We're going to set up for wall squats. Place the ball between your knees and bring your arms with the palms facing forward down by your side. Down by your sides. Imprint the backs of the arms, the triceps, the wrists. See if you can keep them against the wall as you work here. Your feet need to be about 1.5 to 2 feet in front of you. We're going to slide down the wall to where the thighs are parallel to the floor and the shins are perpendicular, creating a right angle with the thighs and shins. Ball stays between the inner thighs and you squeeze in on it. We're going to hold at the bottom, squeezing in on the ball for 4 counts, inhaling to prepare, and then sliding back up to standing on our exhale. So we lower on an inhale, squeeze in on the ball for 4, 3, 2, 1. Inhale, prepare, and exhale to slide back up the wall. Keep your tailbone anchored on the wall. This is a great chance to see if you really are keeping your ribs closed, because there should not be any space between the back ribs, the shoulder blades, and the wall. You want to keep them imprinted, the backs of the shoulders as well. So from here, inhale to slide down into the position. Make sure the knees are not tracking beyond the metatarsals, so the toes should be in front of the knees, but the knees should track between the second and third metatarsals. Once you're back up, check your imprint, back ribs, shoulder blades, back of head, neck shouldn't be pressing in, chin can be retracted like a double chin. And sliding down, pulsing in, 2, 3, 4, inhale, prepare. Exhale to slide up with the braced abs. Inhale to lower, tailbone heavy, back ribs pressing in, present on the ball, 2, 3, 4, inhale, prepare. Imprint and brace the abs to lift you all the way back up. Take that ball, and we're going to set it to the side, grabbing a 3-pound weight, coming into a tightrope stance. If this feels too challenging balance-wise, go ahead and take a staggered stance where the feet are hip distance apart, but one is in front of the other. Once you've found your stance, hold the weight in the same arm as the leg that's forward. We'll take lateral flexion and add the bottom arm, holding here. Inhale 1, breathe, soft bend in your knees. Exhale 1. Inhale 2. Exhale 2. Inhale. And exhale back up through center. And repeating, making sure you're not rolling onto the outer edges of the feet. Feel weight in the heels, bend those knees. Weight in both the bones of the big toes, the baby toes, and the heels. Equalize the pressure. Holding that lateral flexion, adding the bottom arm. Make sure the palms are facing in towards one another. Another great chance to work on your lumbar extension, reaching the tailbone back, creating that arch in the lumbar. Keep your shoulder blades pinching together and your sternum reaching for your spine, so we close the front ribs and access the external obliques. You should have one more set to go. On your breath, inhaling to prepare, exhaling to brace those abs and contract the transverse abdominis. Go ahead and set up on the other side, finding either the tightrope stance or the staggered stance. And when you're ready, inhaling over, adding the bottom arm, exhale 1, inhale, exhale 2, inhale, exhale 3, and bringing your body back upright. Remember your checkpoints, your feet, equal weight distribution. You'll probably feel more weight in the metatarsals, the toes. I want you to find your heels and really ground them into the floor. Keep a soft bend in your knees so that you don't lock out and we don't get that supination or plantar flexion in the ankles. And you've got one more set here, taking it over, closing those front ribs, bracing the abs on your exhale and sustaining the brace. for the duration of the exhale. That's it. We're going to grab our heaviest Theraband and we're going to move towards the wall, standing profile. We're going to move in the transverse plane. We'll actually start facing forward and we'll turn profile so that we have the wall to assist us if we lose our balance. Now, balance work in the transverse plane is imperative because it's where 90% of injuries occur. So you've got your Theraband and we're holding it like a jump rope. We're going to step and find our balance in knee flexion as we did in frontal plane balance work. And now we're going to loop the band around the arch of the foot and we'll extend the leg out. The leg does not have to be straight. I'd rather you keep the knee bent, but the foot dorsiflexed, and arch your low back. So if you're straightening the leg but rounding your low back, that's actually very bad for your back. It's much more important to me that you work with some extension in your low back and a deep bend in the supporting knee. Let's try it again on this side. Stepping to balance first, that's very important. Always keeping a soft bend in the supporting knee, weight in the heel, putting the band around the arch of the foot, and then tipping your tailbone back but firming your core, dorsiflexing the foot. Go ahead and take it to the other side, practicing the balance, turning, finding it, looping the band around, and then holding for 3 inhales and exhales. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. And repeat one more time on this side. Be cognizant of your checkpoints. Feel your heel heavy on the floor. Soft bend in the supporting knee. Don't go for flexibility here. Go for proper pelvic position for strength in your deep layer of your core. That's what's going to alleviate chronic back pain. That's what's going to give you power and strength to bring the body upright so we don't have that forward leaning posture. Okay, excellent. Place the heaviest band to the side. We're going to take a anterior delt bicep release, face the wall, find a V position with your non-dominant arm. The outer thumb should be against the wall as you rotate around, twisting from the torso. The legs will follow. Soft bend in the knees. Close those ribs. Inhale, pull the navel in, lift up on the muscles that stop your stream of pee, and twist further as you inhale through the nose, draw the navel in, lift up on those muscles, firm them, hold the lift, and twisting exhale. Let's go ahead and switch sides. We're on our dominant arm side. We'll be here a little longer. Inhale through the nose, pull the navel in, brace the abs as if you're going to be punched. Twist into that stretch. Inhale through the nose, abs in, lift up on the muscles that stop your stream of pee, and twisting deeper into the stretch. Soft bend in the supporting knees. Feel that sternum reaching for the back ribs. Inhale through the nose, shoulders sliding down the back, abs in, brace, exhale, twist. One more inhale through the nose, abs in, contract, and exhale, twist. Making our way into a quad stretch. Start with your non-dominant leg, grabbing the outer ankle, dorsiflexing the foot, and driving the thigh back. Soft bend in the supporting knee, holding it here. Quick release. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Going to 4. Inhale 4. Exhale 4. And let's set up on the other side. Soft bend in your supporting knee, weight in the heel. Grab the outer ankle, dorsiflex the foot. Collarbone wide, sternum soft. Inhale 1, breathe. Exhale 1, drive the thigh back. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale 4. Exhale 4. And slowly release that. Great work. Grabbing the second to lightest Theraband. I'm going to have you tie it to the roller and place the roller with the band that you've tied, which should be closer to the wall than the outer edge. We're going to do some straight arm lifts that cross the line of the body on the diagonal. We're going to place the ball between the knees to engage the inner thighs and keep a soft bend between the knees. We'll take the arm, let's start with your non-dominant arm so we get more repetitions in on that side. Coming up, so for me, my non-dominant side is my right side, so I'm going to take it up, 2, 3, and down, 2, 3, focusing on strengthening the back of the shoulder, 2, 3, and down. But what's nice about this is we're getting some adductor work, upper body work, and we're working the transverse abdominis because we're unstable. We're having to balance. So I don't want you to take the hand off the wall or counter, but I don't want you clutching it. You should be using those internal core muscles for some of the balance. But the wall is always there for safety. Give me 2 more on this side. And then I'd like you to make your way to the other side. You'll have to move the band, setting up. And when you're ready, we'll begin on your dominant arm side. For me, it's the left. Taking it up on a slow 3 count. Your exhale should be on the way up, and your inhale is on the way down. Palm is facing forward. So palm faces the hip when you start there, and by the time the arm is up in the V, the palm is facing forward. Check in with your breath. Use the breath. It will help the movement. Brace the core. Make sure the knees aren't locking, squeezing in on that ball. And make sure you don't have all the weight in your toes here. I'd like some weight in the heels. You'll probably be more in the center of the foot, kind of wrapping the arch of the foot around the roller, kind of like a bird does when he wraps his feet around a branch. So you can use the arch of the foot here, or you can really challenge the balance and come more onto the heel as you're working. Make sure you're holding the counter or wall, and you feel safe enough to do that if you do choose to come to your heels. Let's go ahead and set up. We're going to do some isometric lunges with lifting and chopping. We'll need a 3-pound weight. Let's start by stepping your dominant leg back, taking the weight to the outer hip, and then up on the diagonal. So this is similar, except we're using both arms to lift and lower. And there's now a torso twist. Before we kept the body straight on, we didn't rotate the body. So I want you to engage the back, but also to engage the abdominals with this twist. We're isometrically holding the lunge to challenge the quadricep here. Give me 4 more twists, really working on the strength of that non-dominant quadricep. Breathing into that. After your 4th one, go ahead and switch sides. Since this is your dominant side, we'll do 6 here, taking it up on the exhale, lowering on the inhale. Now, if you find you don't have the balance to go that quickly, exhale to lift and lower. So pause on your inhales to prepare and lift up on the exhale, pause at the top, inhale, and lower down, exhale. Make sure the weight isn't all forward in the toes, the knee isn't tracking beyond the metatarsals, the ribs are closed, the chin's retracted, and head is back on the spine. A lot of checkpoints. Let's go ahead and set up for a series of balance work, moving forward and back in the sagittal plane. We need our lightest loop band to go around the ankles, and we'll hold on to that 3-pound weight. Do this exercise by a wall for safety purposes. You're going to step forward. Your outside leg will come up into knee flexion and you'll balance that weight. Just putting your pointer fingers there for safety. Holding, inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Hold on to that weight and put the foot down. Now I'd like you to step the leg closest to the wall back and lift the outside leg again, resting the weight on it, balance. Hold it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. And turning around, repeating on the other side. Make sure your foot's dorsiflexed. Do your checkpoint work, stepping to balance, hold. Where's the weight distribution in the foot that you're standing on? Is your tailbone tipping back? Are you rounding your low back or are you arching it? Are your ribs closed? Is the head on the spine or is the chin forward? Retract the chin, give me a double chin. Keep the collarbone wide, keep the sternum reaching towards the back ribs, and repeat one more time, stepping back. So I want you to practice moving through space to balance. This will really help your proprioceptors and your neuromuscular system to fire. When you do lose your balance, you'll be able to catch yourself because your muscles are used to recovering quickly and unilateral balance work. Holding, dorsiflexed foot. And let's go ahead and come out of that, setting the loop band to the side as well as the weight and grabbing a chair. We'll need our heaviest Theraband. We'll use the chair and the wall for a hamstring stretch with the dorsiflexed foot. Let's begin with your dominant leg. Wrapping the band around it, isometric row. You can hold it with the outside hand and one hand on the wall for extra security. Or if you feel balanced today, you could hold the band with both hands and do a row here to engage the back muscles, with the emphasis being on the hamstring stretch. So I'd rather you hold on to the wall if you're rounding your low back. And it's likely you are because the hamstrings are very, very tight due to your posture. So quality versus going hardcore. Let's think about longevity and really opening those hamstrings for better range of motion. So tip your tailbone back, dorsiflex that foot hard, softly bend that supporting knee. Make sure you're not rolling out on the foot or locking the knee. And then you're hinging forward from the hips to intensify the stretch in the hamstring. And you can hear your breath. Each exhale is a chance to go a little deeper into the stretch. Great. Let's make our way to the other side, setting up. Once the chair's there, you dorsiflex the foot, bringing it onto the chair, looping the band around it, holding it with the outside arm, tipping the tailbone back, softly bending the knee, reaching the chest towards the thigh without losing the extension in the low back. Holding it here. Inhale. Exhale, deepening the stretch by coming forward just an inch. Inhale through the nose, draw the navel in. Lift up on those muscles that stop your stream of pee. And exhale to deepen the stretch. And one more time, inhale, abdomen in. Lift up on the muscles that stop your stream of pee. And exhale, lift, deepening into the stretch. Go ahead and let's stand center without the band or chair. And we're going to grab our opposite wrist, crossing one leg behind and taking a nice side body stretch here, pressing the pelvis forward. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Switch sides. And inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Great work.